Hey guys, so a while ago I posted a reaction video to the trailer of the movie 5 Feet Apart, which is a movie that kind of goes through the idea of a relationship of two people with cystic fibrosis and how CF gets in the way and the idea of cross-contamination and all the problems with that. So I've recently seen the movie. I've actually seen it twice. I saw it when it first came out opening weekend, and I thought about kind of making something talking about it, and I just hem and hawed around it. So I went and saw it again this past weekend, so I'd have a fresher, idea of the plot, and I'm sure I'll still forget things. So as I was watching through the movie the second time, I tried to make a note of things that I wanted to point out and address. So here it is. I guess the first thing I think that's really important to say is that every person who lives with CF lives their life so differently that it's a complete impossibility that the movie was going to capture any one person's full perspective and story and hardships. So that being said, I don't feel like I can greatly address a ton of the inaccuracies. Just because I don't experience something doesn't mean it's not a reality of somebody else with CF. I think that's really important because just so many bits and pieces are things that I can relate to, personally, physically, emotionally. So that doesn't mean that something else that was portrayed is wrong. It just might not be my experience. Sorry. A bit winded today. And then one of the other things I wanted to kind of point out, and that I'll kind of talk about a little bit, the little things that I don't want to call inaccuracies, I can see were done for the filming perspective. Like, we see these kids wear masks a lot, and we also see them take them off. Like, they're definitely not wearing masks in a hospital as much as someone with CF should be. But also, you can't get a great emotional perspective of someone's face with this much showing. So I like, as a past theater student, it's kind of like cheating to the audience. So I think the reality is that majority of CFers would be wearing a mask almost 100% of the time. Even I'm guilty of cheating and taking off my mask when I'm off the floor or the unit, but not often. Certainly not the whole time. Usually it's just if I need to take a break and catch my breath. Because those masks do make it hard to breathe. They're not really that great. Whether you use a reusable one or the disposable ones, they get hot, they get stuffy. You can't breathe. We can't breathe anyway. So adding the extra layer of, filtering doesn't make it any easier. I don't want to spoil any major plot points, so I'm not going to give a ton of things away. Nothing major, but there may be some spoilers for those of you who haven't seen the film yet. So that's just a warning. One of the things that I really rolled my eyes at was when it must be wherever they're located. I don't remember, but it kind of gave a vague idea. But they leave the hospital and go for a walk in the snow. And my thought on this was like, I don't hardly go outside when it's that cold out anyway, because you can't breathe. Especially going from such a controlled climate environment like a hospital to outside where the air quality is just not controlled, obviously. It's just, that seems like that just seems stupid to me. A couple of things I thought were a bit just not portrayed as reality. There's a handful of times when they run up and down the stairs, or at least Stella, the main female character, she runs up and down the stairs a handful of times, even on oxygen. That is a pretty unrealistic thing to do. And it does show her at the end of these flights of stairs, stopping to breathe or coughing, and it kind of portrays this idea that, okay, I can get through this activity. At the end of this activity, I have to stop and catch my breath. When I think the reality is much more of, up 2 steps, gotta stop and catch my breath. A couple more steps, you gotta stop to take a minute to breathe. It is not a quick thing. And sometimes catching your breath can take a long time, which I don't expect that to be portrayed in a limited, time film, but just to put it out there. Now, I can say for my hospital, I've seen some people mentioning there's a point where they're on the roof of the hospital outside. I've seen people talking about how that would never happen, but at my hospital, you can't get on the roof of the building, that I know of, but it's very easy to get on the roof of the parking garage, so that's not unrealistic. It's pretty easy. Some people have talked about getting off the floor, like you can't leave the floor. Shoot, maybe you're not supposed to, but I sure do. Yeah, it's pretty, as a regular CF patient, I have never been confined to one place, so I would find that, I wouldn't listen to that, to be honest. If I want to go to the cafeteria to get something that's not on the menu, I'm going to do that. As long as I feel I can make it there and back without needing assistance, I'm going to do it. That's not, of course, not a rule for every center. Some people, I've even heard some clinics keep CFers confined just to their one room, which sounds completely horrible. I know at my center, from what I understand, patients with Burkholdia, with B. cepacia, they are quarantined to their room. Now, the problem with cepacia is that it's not just a risk for people with CF. It can be a risk for anyone with a compromised immune system. It's a really bad bug, and there's just recently a study has come out that they found more information on it and maybe even ways to treat it eventually. Still very much trial and guessing, but the good news is that they're working on it, so hopefully those of you with cepacia can join the rest of us in a longer life and maybe even the transplant list someday, should that become necessary for you. But right now that's true. People with cepacia, B. cepacia, are ineligible for transplant unless you can go so long without culturing it. So I think it's good that they included that, because a lot of people think you're sick, your lungs don't work, you get a transplant, it's better. And the reality is some people are too sick to qualify for a transplant, and some infections like cepacia disqualify you for that to even be an option. So I like to say it's not, I don't think it's specifically, maybe they do actually come blatantly say that, but it's nice to see that kind of representation, because that's a whole other side of the CF community I think that doesn't really get a lot of attention. Those people who don't qualify for transplants. One thing I wanted to talk about that I think I would have liked to just see mentioned, or just kind of, maybe not said, just hinted at, but transplant itself is not a cure for any disease out there. Lung transplants specifically are one of the hardest organs to transplant. There's a lot that isn't known about transplant, but the reality is they fail. They're not permanent. Though some people can live long lives with them, it just is a very sad reality that many, many people who receive them don't. And I felt that it was hinted at that the main character's problems, a lot were going to be solved, at least medically, were going to be solved when she received new lungs. And the reality is on the other side of transplant, some people are worse off. not everybody comes through that with a better life. And even though that, that's always the hope and the desire, but I think it's important. And if you're gone through the transplant process, you should have been told this and explained that transplant itself is like a new disease. And when it comes to CF specifically, transplant doesn't take CF away. CF is a genetic disease that affects your whole body, and it's genetic, so it's in your DNA. And when you receive new lungs, they do take out all that lung infection, those lungs that have all that damage and that scar tissue, and they put in new lungs that are, for the most part, they're clean. There are some high-risk situations, but for the most part, no doctor is going to give you lungs they think you can't handle. But there are so many things that come with that procedure that it's basically a whole new disease to deal with. And then you still have CF in the rest of your body. Now, your DNA and the DNA of these new lungs is never going to cross. Your new lungs are never going to have CF. But that's not to say that CF will not still affect you. It's still a problem. Post-transplant, post-lung transplant, some people even require a second transplant, be it a second lung transplant, kidneys, a pancreas. So it is not a cut these out, put those in, fixed problem. And I just kind of would have liked to have seen maybe just that mentioned. They did a pretty good job, I think, representing the multitude of personalities you will meet in people who have CF. I can say that for most of my runs. I should say there are 3 CFers in the movie. This isn't a spoiler. There is the main female character, Stella, who it discusses that she's created this app to help people who deal with chronic illnesses be able to keep their medications in time and scheduled and all that. She does vlogs to help educate people, and she works hard to give back to the CF community in the film, much in a way I feel like Claire Wineland did. If you don't know Claire, Haley Lou Richardson, the actress who plays Stella in the film, worked with Claire to help get a better understanding, directly what CF kind of looks like in a person. Claire was kind of that model and worked to make the details of the film better. And Claire was very much, I think, a Stella for the CF community, in the terms of vlogging, educating, doing a lot of work to improve, awareness and the mental health of people with CF. So Stella is very much that person, upbeat personality, happy,